Antidepressants are for depression and other mood disorders. It works by changing the brain chemicals, by changing the neurotransmitters such as serotonin, norepinephrine, and dopamine. So the mechanism of action will be always around the serotonin, norepinephrine, and dopamine. Serotonin was controlling mood, sleep, appetite, and norepinephrine was about alertness, allergy, and dopamine was about pleasure, motivation. What else? Movement, because we were, let's say, increasing, for example, or replacing the dopamine levels in the anti-Parkinson drugs. So dopamine was also about movement. Or in the antipsychotic drugs, we were reducing the dopamine levels. Why? To reduce the hallucinations. So our first drug group name, this was a general information. Our first drug group name is selective serotonin reuptake inhibitors. I did not text serotonin here. Most of the places will be, most of the text here will be maybe absent or weird. I'm just going to explain them to you. So I'm just very lazy to fix them. I'm going to explain them. Don't worry. Selective serotonin reuptake inhibitors, just like its name, they are blocking the reuptake of serotonin. And the drugs we will see here is escitalopram, citalopram, fluoxetine, sertraline, paroxetine. Melissa, what is important here? The important thing here is serotonin syndrome. Let's say that you are using selective serotonin reuptake inhibitors, these drugs, and here serotonin and norepinephrine reuptake inhibitors. If you use both of them together, the serotonin levels will be increased, and as a result, we see serotonin syndrome. In the treatment of the serotonin syndrome, we use cyproheptadine. And why is the serotonin syndrome so important? Why is it dangerous? Because it will cause fast heartbeat. It will cause dilated eye pupil. It will cause sweating and more things. And side effects, one side effect of selective serotonin reuptake inhibitors is sexual problems, sexual dysfunction, or we can say insomnia, diarrhea. And another drug group is serotonin norepinephrine reuptake inhibitors. This is just like the one that we talked about, but just plus norepinephrine. The drugs here will be venlafaxine, duloxetine, desvenlafaxine. And now three cyclic antidepressants, TCA. There is amitriptyline, imipramine, nortriptyline, and clomipramine. The most important thing here is cardiac toxicity. Cardiac toxicity happens because three cyclic antidepressants are blocking sodium channels. Cardiac toxicity causes fast heartbeat, low blood pressure, even death. It causes dangerous heart rhythm problems. That's why when someone tells you three cyclic antidepressants, you're going to remember cardiac toxicity, fast heartbeat, low blood pressure, death. Do we use something as an antidote for the cardiac toxicity which is caused by three cyclic antidepressants? Yes, it is sodium bicarbonate as an antidote. But if someone asks you three cyclic antidepressant drug names, you're going to say amitriptyline, imipramine, nortriptyline, clomipramine. What is the mechanism of action here? It can also block histamine, muscarinic receptor, or alpha-adrenergic receptor. Yes. Another drug group is monoamine oxidase inhibitors. So, as we can understand from its name, it's blocking monoamine oxidase. But why? What's the reason? Because monoamine oxidase is blocking serotonin, norepinephrine, and dopamine. That's why. The drug names here will be phenelzine, selegiline, isocarboxazetes. What is important here? There is something called hypertensive crisis. When you take, let's say, monoamine oxidase inhibitors, one of those drugs, and if you take tyramine-rich food, like what? Like cheese, wine, fermented food, you will have hypertensive crisis. Your blood pressure will be going extremely high suddenly. Another drug group is atypical antidepressants like bupropion. I'm sure that you know bupropion from the, let's say that I'm not smoking, but let's say that I'm smoking. If I want to stop smoking, I also use bupropion. Some days before stopping smoking, they give it to you. That's a drug like that. The good thing is that it does not cause any sexual problems, but it causes seizure, and it is banned in Turkey because of some risks like that. For example, they said there is a risk of mouth cancer. They said like that. It is increasing dopamine and norepinephrine levels. It is the mechanism of action of bupropion, increasing dopamine and norepinephrine levels. How? By blocking dopamine and norepinephrine transporter. It is blocked, and as a result, dopamine and norepinephrine levels are increased. And another drug is trazodone, which is mostly used as sedative. Another one is mirtazapine, which is increasing norepinephrine, serotonin, but it is also increasing the appetite. It can cause weight gain. It's good for insomnia. It's blocking the alpha 2, 5-HT2, 5-HT3 blocking. So we are finished with our drugs. What is important lastly? Let's just memorize it. Selective serotonin reuptake inhibitors. What was it? Serotonin syndrome. We were using ciproheptadine as an antidote. TCA, tricyclic antidepressants, we were thinking of cardiac toxicity. We can use sodium bicarbonate as an antidote. Monoamine oxidase inhibitors, we were thinking of hypertensive crisis, which was with tyramine-rich foods. And never stop these kind of drugs like antidepressants suddenly, because it can cause flu-like symptoms, headache, and more. And you cannot decide, I'm not in the mood to take antidepressants, I'm feeling good. No, you're going to be taking however your doctor said. Full effect will be taken between 2 to 6 weeks. You're going to listen to your doctor, and it will not work very quickly. It will take some time. I just want to remind that in the first weeks, like first times of the treatment, we see suicide, sadly. And never use selective serotonin reuptake inhibitors with anticoagulants because there is bleeding risk.